position, what we are usually doing, well, you can do it in prone. Well, I'm going to summarize the different approaches that sometimes different schools may do. This is just to give you the information, and then you take what you prefer, okay? Because the objective is to needle this as safer as possible, so you can choose. One possibility is this sideline. Which is the advantage of this? If the patient has not a very stiff scapular area, usually, as you can see, for example, in this patient, it's very easy to reach this part. You can palpate, for example, we can palpate these thought bands, so it's very easy to access here, okay? So one of the possibilities is that I can palpate a thought band, I can put my fingers at both sides, and I can do drain needling. And in this direction, I'm going to be parallel to the thorax, so I'm going to lead the needle towards the medial border of the scapula. What happens if I go a bit more anterior? Well, if I go a bit more anterior, I will be reaching the subscapularis muscle, okay? It doesn't happen anything, but what happens instead of being very parallel, I would be doing like this. I'm going to the thorax, okay? So the idea is always to be controlling that the needle is like this. If you use a very long needle, it can be a problem because you have to lean against the thorax, but we are going to use 2.5 or 3. We don't need a long needle, okay? So we are going to control the needle well here. So we are going to make drain needling in areas of the rhomboid, mid trapezius, or if we go a bit lower here, in the lower trapezius, okay? This is one possibility. Other possibility, which is very similar, could be in prone. But which is the problem in prone? That we have to take the needle very parallel. So sometimes some schools, what they recommend is, okay, I take this like this, so I take the scapula a bit out, and I can go in a bit. But sometimes this is not very comfortable for the patient. Other possibility is that if the patient has real problems to be treating this area, perhaps the patient may try to move a bit, or we try to push a bit, okay? So we are going to show the technique like this. You try, this is very safe. And I think that in the future you feel very safe, or you trust yourself a lot, okay, you can change to pro. Sometimes it's a question of comfort, because, for example, when I'm treating a patient in pro position, I say, well, I'm not asking him to change, and I'm doing it wrong. But for starting, it's better this, okay? So we are going to select. This is the same procedure even if you do lower trapezius, mid trapezius, rhomboid. So the important point is to find the thought bands, and for this, you have to use your palpation according to the orientation of the fibers, okay? Although, if you have a look to the ultrasound image, well, if you are doing the mid-trap, you are going to do the rhomboid, okay? They are very close, okay? So here, if I touch as a reference, I feel the bony surface of the ribs. If I know that the ribs are there, what I have to do is this, okay? So, see. First of all, I'm going to palpate, and then in this position I can treat the central trigger point, and then I can try to finish in the bone. Just touching the bone, not hitting the bone, but I can also ask the patient if this pain is also familiar, because you will find a lot of time that sometimes there is a central trigger point, but sometimes the pain of the patient is just here in the attachment. It's very sensitive, okay? Me tienes que echar alguna foto, Sandra, joder. Que me tienes abandonado. En el bolsillo de la mochila. She never makes any photo. Do you allow to make a photo of your back?
Yeah.
Okay? You don't have copyright? Okay. Well, we are going to use 2.5. I think it's more than enough. For example, if we wanted to treat subscapularis, we are not including here. Sometimes we use 4, 5, 6, because we want to go to the anterior. So the key there is to touch the scapula in the anterior part and always be touching the scapula to be controlling, okay? Okay, so I'm going to prepare the needle and I'm going to palpate. So let me know if there are more sensitized points.
Okay.
Here a bit.
Yes. No, here.
I'm going to look for different points. So I can try more or less like lower trapezius or here the rhomboid, well, or I can be changing the direction to see if I see mid-trap or any orientation of the fibers, but mainly.
Actually, for the physician clinic, I think it's not comfortable. What do you think?
Are you comfortable?
Yeah. Fine. No.
Do you mean the patient or what? Ah, for the picture is not comfortable.
No. I say without the picture, I don't know, not me.
No, well, this position.
I mean, the neck is not supported. That's what I mean.
Well, I think the main problem for this position is if you are having shoulder problems. People with shoulder problems is not going to tolerate. But for the rest, well, you can put a pillow or not. You ask the patient. Well, he seems comfortable at least until I put the needle. Okay? Well, but you always ask the patient, okay? Sometimes you ask the patient and the patient says, no, I'm comfortable. And you feel the patient doing like this. I say, well. Here, I think, well. Here. Okay, so I'm feeling a trigger point here. The top band is like this. So in this case, I'm trying to fix like this to leave the space, okay? So I'm going to put like this, and then what I'm going to try is to make the orientation like this, okay?
Towards the scapula.
Yeah. Like to the medial border of the scapula, okay? Here, for example. So I was a bit anterior, I changed a bit posterior, and here I found it. Did you feel the twitch?
I feel something. Yeah.
Okay. Now?
Pain on
But more or less you see that this is... Well, okay. There's not a lot of twitches. I can show you now my preferred technique.